This is the second video in Facility Management and Safety program. It's about security management. For more videos, visit my Facebook page, Healthcare Quality. Security refers to protecting the organization's property and the patients, families, visitors, and staff from harm. The hospital plans and implements a program to provide a secure environment. The security program ensures that everyone in the hospital is protected from personal harm and from loss or damage to property. Children, elderly adults, and other vulnerable patients unable to protect themselves or signal from help must be protected from harm. Restricted areas such as the newborn nursery and the operating theater must be secure and monitored. In addition, remote or isolated areas of the facility and grounds may require the use of security cameras. Security inspection vulnerability reports are completed to indicate areas of risk, including security vulnerabilities of sensitive areas, security habits of personnel, and staff knowledge and skill. An inspection gives a good indication of future danger, and immediate steps shall be taken to eliminate the problem. The goals of security management plan. The security guards have to address security concerns of patients, visitors, and personnel. Control access to and egress from sensitive areas. Reduce the risk of security incidents. And education awareness training. A security incident report is completed on all incidents involving patients, visitors, employees, or property. For example, damage, loss, or stolen property, injuries to staff caused by patients during assessment and treatment activities, or criminal activities. This will be done by the security officer on duty at the time of the incident, or the department director if no security officer is available. All incidents will be aggregated on a quarterly basis and reported to the safety committee by the director of security. The safety committee will track and trend all incidents by type to determine if pattern exists. Identification cards. All patients, visitors, and personnel will have appropriate identification. All employees and staff shall wear hospital picture identification badges. Inpatients will wear permanent identification bands. Emergency department patients will wear temporary bands. All visitors will obtain a pass, visitor's card, from security officers. All personnel shall stop and question any unidentified person in their area. Politicians, entertainers, and persons with a history of domestic violence will enter hospital through emergency department. Any inquiry from the news media will be directed to the Director of Community Relations. Additional security measures will be implemented for the physical protection. Security will keep the limited emergency department and urgent care parking clear for authorized vehicles only. Patient elopement. When a patient is first noticed as having left without notifying staff, the patient care unit staff will immediately search the unit. If the patient is not found on the unit, the security department will be notified and a hospital-wide search will be implemented. The nursing supervisor will contact the patient's family to determine if the patient was removed from the hospital by the family. All attempts will be made to locate the patient, including notifying local police as necessary. An incident report will be completed on all patients' elopements. Hospital emergency codes. They are coded messages often announced over a public address system to a hospital to alert staff to various classes of on-site emergencies. The use of codes is intended to convey essential information quickly and with minimal misunderstanding to staff, while preventing stress and panic among visitors to the hospital. These codes have often varied widely by location, even between hospitals in the same community. Confusion over these codes has led to the proposal for and sometimes adoption of standardized codes. For example, Code Blue indicates a patient has entered cardiac arrest, while Code Red indicates that a fire has broken out somewhere in the hospital facility. In order for a code call to be useful in activating the response of specific hospital personnel to a given situation, it's usually accompanied by a specific location description. For example, Code Red, second floor, corridor 3, room 220. Other codes, however, only signal hospital staff generally to prepare for the fallout of some external event such as a natural disaster. Personnel are trained in the actions to be taken in the event of a security incident. For example, infant abduction, usually referred to as Code Pink, workplace violence, usually referred to as Code Strong, civil disturbance like bomb threat, usually referred as Code White, attempted robbery, and violations to smoking policy. Infant abduction or discharge to wrong family. All nursing staff and other hospital staff involved in the care of the infant or child are obliged to wear their ID card while on duty. Immediately after delivery, responsible nurse must apply ID bands to newborn with corresponding name of the mother, 6, time and date of birth, 2 on both legs, and 1 on the right upper arm. All staff working in the unit should be provided with instructions and educations on the things to be asked to the visitors. Only the parents are allowed to visit the newborn in NICU and PICU, showing their identification cards or ID bands. No visitors are allowed to stay overnight in the patient's room. Code Pink. Whenever a child is missing, the head nurse announces Code Pink to the operator and identifies the area. Charge nurse will brief the nursing supervisor and medical director on duty for assistance. Staff nurses should keep all doors closed and locked within the unit. Nursing supervisor must inform all the floors to be on guard and to ask assistance from the head nurses to check all rooms and to keep the vacant rooms locked. Medical director must decide to call for police force if assistance is necessary. Senior guard on duty will order his co-security guards to be posted in the major exits and the fire exits of the hospital to check the identity of all persons. Porters should be on guard in each elevator and must be informed of the identity of strangers. Workplace violence. For many years, healthcare workers have faced a significant risk of job-related violence. Assaults represent a serious safety and health hazard, and violence against their employees continue to increase. Periodic inspections for security hazards include identifying and evaluating potential workplace violence, security hazards, and changes in employee work practices which may lead to compromising security. For workplace violence, we use Code Strong. Here is an example of a checklist that could be used to indicate a potential risk for serious security hazard. Bomb threat. The main objective here is to provide for rapid, orderly, and responsible action during a bomb threat or the discovery of a suspicious device in our hospital. Response to a threat or suspicious device is to be calm and orderly, to prevent panic and protect patients, visitors, staff, and property. Threats are taken seriously and reported immediately to the local police department. If a suspicious package or letter is identified, do not shake or open the package. Leave the package where it is. Do not use a cell phone or other handheld electronic devices in the vicinity of the package, letter, or object. If any suspicious residue, liquid, or odor is evident, evacuate persons from the immediate vicinity and isolate the object if possible. Any person receiving a bomb threat via the phone should remain calm and attempt to obtain as much information as possible, such as note exact time of call, extension on which call was received, displayed phone number if possible, background noise, voice characteristics or accent of the caller. Ask, when is the bomb going to explode? Where is the bomb? What does it look like? What kind of bomb is it? What will cause it to explode? Did you place the bomb? Why did you place the bomb? Notify a coworker to contact local police from another phone. Keep the caller talking for as long as possible. Here is an example of a bomb threat report in which all the details of the situation could be documented. We usually use code white for bomb threat. No smoking policy is one of the important security concerns. Smoking is considered as a health hazard for smokers as well as non-smokers. It's a major contributor to the starting of uncontrolled fires and is a significant source of dirt and grime. Enough number of no smoking signs distributed throughout the hospital to inform staff, patients and visitors of the hospital's no smoking policy. All hospital employees, contractors, personnel, patients, visitors, volunteers, etc. should adhere to the no smoking policy. Persons who want to smoke may do so only in designated smoking areas where ashtrays are provided. These designated areas should be located outside the main hospital entrance. Inpatients who meet the following criteria only may be allowed smoking privilege by the prescription of attending physician. 1. Psychiatric inpatients, if prohibiting the patient from smoking would adversely affect the patient's emotional well-being or ability to actively participate in the recovery process. Number 2. Inpatients experiencing terminal illness, where, in the opinion of the attending physician, no benefit would be derived from prohibiting the patient from smoking. In these cases only, the patient must smoke only in the designated smoking areas, sitting rooms with the door closed. The patient must be supervised by a capable sitter, family member, or other qualified personnel while smoking. Hospital staff will be disciplined for violation of this policy using the standard hospital procedure for non-adherence to organizational policies and procedures. Contractors' personnel may be disciplined for repeated offenses in accordance with the policies and procedures of their employers. Visitors or outpatients will be verbally warned by nurse or ward clerk staff. In case they do not adhere to the hospital's no smoking policy, they will be asked to leave the facility. Security personnel will be notified and asked to escort the person from the facility if necessary. Thank you.